All right, well, let me officially welcome you now to Empower Missouri's 2026 Week of Action. My name is Lucas Caldwell McMillan. For those of you who don't know me, I am Chief of Policy Staff and work with our great policy managers here at Empower Missouri. Today, our focus in the food security realm is on food is medicine. Thanks for being here with us. Before we jump in for today's event, which is our first day of our week of action, just wanted to invite all of you, if you're able to join us same time, same place tomorrow, Tuesday and Wednesday, where we'll be talking about tomorrow with our community justice policy managers, a focus on avoiding just spending more money building new prisons, but actually working on evidence-based interventions that reduce crime and support Missourians without wasting billions of our dollars on building new prisons. And then Wednesday, great topic from our affordable housing team. We'll be talking about an opportunity, the first time ever since 1994, we've had bills by both parties to increase funding for affordable housing in Missouri by increasing funding to the Missouri Housing Trust Fund. So we'll be talking a little bit more about the Missouri Housing Trust Fund, and of course, taking action to reach out to Jefferson City and encourage and support policies that create more stable homes. So same time, same place, Tuesday and Wednesday for our week of action. For those of you who are new to Empower Missouri, we are Missouri's oldest statewide anti-poverty organization. We have been doing advocacy for over 125 years. So 2026 is our 125th anniversary. And I'm sure you'll get more emails and potentially some merchandise as well, some shirts that celebrate that. But yeah, we've been doing this for 125 years. Maybe not exactly this. I thought about this. I don't think they had Zoom 125 years ago, but we have been coming together with people across Missouri to learn about an issue and, most importantly, advocate in our capitals and local governments to improve the lives of our fellow Missourians and fight poverty. So this is something we've been doing all collectively as a state for a long time, and I'm glad you joined us today to do that. I'm going to turn it over to our two food security policy managers, Amanda Berry and Christine Woody, who are going to take us through today's topic, food is medicine. I believe, Amanda, you're up first, so I will turn it over to Amanda Berry.
All right, fantastic. Thanks, Lucas. And like you said, I'm Amanda Berry, and I'm gonna get us started first. Wow, I feel like we got quite the turnout. And thank you all for joining us today and for your interest in food security. So we're going to start off the hour with a little information on Empower Missouri and food security in general. Then we have Kate Hensley with the National Food is Medicine Coalition, who's really going to dig into what food is medicine is all about. Then we'll have some Missouri specific health outcomes that could be impacted by a statewide food is medicine program. Introduce this session's food is medicine legislation. And lastly, once everybody's all hyped up and ready to take action, we will collectively share our support for House Bill 2355.
Yes.
Next slide, please. Thank you.
Is in this picture here behind me with that corn growing in.
So Lucas kind of stole my spiel here, introductory, but it is our 125th anniversary. And I was just going to say, I believe that's quite the accomplishment. Our mission is to work to secure basic human needs and equal justice for every person in our state through coalition building and advocacy. Our vision is a Missouri in which all people have food, shelter, and justice. Our work is driven by our values. We believe in adequate nutrition, affordable housing, and equal justice being essential for all Missourians' success, and that all structural oppressions should be recognized, challenged, and dismantled. We believe that evidence-based public policy is foundational for those who govern, and that the lawmaking process is truly accessible to everyone in our state. So I would say being the oldest anti-poverty organization shows that we've done a really good job at living this through our work. So this slide kind of shows how we live our mission, vision, and values. We lead 3 statewide coalitions: food security, community justice, and affordable housing. And through them, we're able to organize, provide legislative advocacy, and collaboratively set agendas. We offer a variety of training opportunities to the public, to organizations, students, and just really anybody who's interested in learning. And lastly, we work really hard on building relationships with legislators so that we can be considered a trusted and reliable source of information, education, and a partner in advancing policies that align with eliminating poverty. So, like Lucas said, today is the Food Security Day of our 3-day week of action. And I just want to take a moment to level set and review what food security is. Food security exists when all people at all times have physical, social, and economic access to sufficient, safe, and nutritious food that meets their dietary preferences for an active and healthy life. It's a really long sentence. I'm glad I don't have to say it 3 times really fast. Economic access to food means that a person has the financial means to purchase food products, and that includes the necessary materials to cook and consume it. So things like high prices or insufficient income can reduce economic access, while higher earnings, safety net programs, and other social protection programs can improve it. Physical access really refers to how close someone is to a place to get food, and economic access does not guarantee physical access. Social access refers to the social, cultural, and political factors that influence an individual's ability to acquire food. So an example of that would be the SNAP bans that prohibit certain people from accessing SNAP. Today, we're going to focus on a program and policy called Food as Medicine, which technically falls into all 3 of the access categories and is a proven way to improve food security and the health of Missourians. Next slide, please. So we are fortunate today to have Kate Hensley with us. She's the manager of policy and projects with the National Food as Medicine Coalition, and she knows a lot more than I do about food as medicine. And she's going to join us and really get into the details about what it is. Kate, are you there?
I sure am. Hi, Amanda.
Hello, so glad to see you again, and thank you so much. I think we're gonna screen share with you, I believe.
Yes, you sure are. So just give me one moment here. And are you all seeing the pretty side of my slides? Okay, perfect.
Beautiful.
Well, thank you so much for having me today, folks. I got my start as a food as medicine advocate in St. Louis right after grad school. So I'm so thrilled to get to chat with Missouri-based advocates today and really get to dive into what food as medicine is and the power and promise of these interventions for Missourians. So we're going to start with exactly that. When I say food as medicine, what do I mean? So food as medicine is such a broad term. How can we really anchor it for these conversations around policy and advocacy? First, we always like to start off with the acknowledgement that food as medicine is not a new concept. And for many communities, food is the first medicine, in particular for Indigenous communities. And in some ways, as we're engaging with these conversations around food as medicine, healthcare is coming full circle back to its roots, recognizing that nutrition impacts health in profound and measurable ways. And that the field of nutrition science is incredibly well established with its own professional clinical criteria and certifications. And how did we get to this moment of pretty unprecedented notice in the field of food as medicine? We really like to anchor our conversations in the Aspen Institute's Food as Medicine Research Action Plan. And I'll pop that link into the chat once I wrap up here. And this represents community alignment around realizing food as medicine. And we had to agree on a definition. FMIC was engaged in this process. And this definition has 2 key components. First is that food as medicine is the provision of foods that support health. And it has 3 foundational interventions: medically tailored meals, medically tailored groceries, and produce prescriptions. And that this food has a nexus to the healthcare system. So this is not an endpoint, but it's a solid foundation from which to start our discussions. And food as medicine really is an evolving concept. So on the right is how we conceptualize. This is a common rubric for representing the food as medicine field that our executive director contributed to the creation of this. And it's one way to represent the continuum of food as medicine services. We also sometimes like to think of it as a speedometer, because this presents a bit of a hierarchy, which is certainly not something that we represent in the field. But the pyramid really represents population. So up top, MTMs, medically tailored meals, are for the smallest amount of folks managing severe, complex, and chronic illnesses with this nutrition intervention. And all the way at the bottom, we have broad population level healthy food policies and programs, something that as food security advocates, you all are engaging with day to day. And on the left, we have a spectrum from prevention at the bottom all the way to treatment. And nutrition education is a key piece of all food as medicine interventions. So down at the bottom of the pyramid, we understand that healthy food for all promotes human flourishing. And up at the top of the pyramid, there are medically tailored options that really address specific disease states and are often for folks that are managing more than one complex chronic health condition. And all of this really emphasizes that it's clear that provision of food is a part of healthcare. And at the Food as Medicine Coalition, we focus on these top two interventions, medically tailored meals and medically tailored groceries. So, who are we? The Food is Medicine Coalition. We are the national coalition of nonprofit organizations that provide medically tailored meals, medically tailored groceries, medical nutrition therapy, nutrition counseling, and education to people in communities across the country living with severe, complex, and chronic illnesses. We advance access to these life-saving interventions through policy change, research and evaluation, and sharing of best practices. Importantly, our agencies created the medically tailored meal model over 40 years ago, and FMIC manages and maintains the nutrition standards for the intervention. We also offer a community of learning for existing practitioners, and we equip new organizations to launch medically tailored meal programs. So a little bit about our history. I think it's really important to ground these conversations in a conceptualization of the modern food as medicine history. So our medically tailored meal providers began over 40 years ago as a community-based volunteer response to the AIDS pandemic. So medically tailored meals were conceived at the time by volunteers who were going into their friends and neighbors' homes bringing groceries, and they came back the next day and seeing that they went untouched because folks managing HIV or AIDS were so sick that they could not prepare the food for themselves. MTMs were conceived to combat wasting, improve side effects, and bring dignity to the lives of clients living with HIV or AIDS when no other treatments were available. Then, when antiretrovirals became available as a treatment, the MTM service evolved to meet the new medical and nutrition needs of clients, and practice expanded to meet the needs of those with additional illnesses like cancer, cardiovascular disease, renal failure, and more. Now, our agencies serve people living with over 200 different diagnoses, and most of our clients are managing more than one chronic health condition at a time. Also, super important, the role of the registered dietitian nutritionists. They have been foundational to the intervention since the beginning, ensuring that MTMs and that the medical nutrition therapy provided conform to nutrition best practices. So, now that we've heard a little bit about the history of the intervention and how the intervention has evolved, why do we know this intervention works? So I've got some links to share here around existing research in the field, but want to share just a couple kind of high level important pieces around why these interventions are truly life-saving. So we've always been connected to clinical care, and because of that, researchers and evaluators have really spent probably around the last decade or so developing a large body of efficacy evidence. So it's unsurprising that over time, peer-reviewed research has shown that this life-saving service produces both better health outcomes and it lowers the cost of care. So we know that MTMs improve mental health, create healthier long-term eating habits, like increased vegetable intake, support management of diabetes by impacting HbA1c, improve medication adherence for folks managing HIV. And overall, when people receive MTMs, they report an improved quality of life, and they have fewer days where mental health interferes with that quality of life. And we also know that MTMs lower the cost of healthcare. So MTMs are a win for our policymakers and for our communities. There's some really incredible cost modeling studies that have come out of Tufts University showing what it would mean if MTMs were given to all eligible folks within just 1 year. So modeled nationally in only a year, MTMs could save 13.6 billion with a B in healthcare spending and avoid 1.6 billion hospitalizations. So we know that provision of MTMs reduces the frequency of hospital visits, reduces ER admissions, reduces the length of stay at a hospital for folks, and all of those lead to health savings. And we also know that MTMs improve food security, leading to long-term improved health. So our vision at FIMIC is a future state where anyone who needs the medically tailored meal or grocery interventions has access to the highest quality service, regardless of their ability to pay or where they live. We advance that vision through our mission. We focus on 4 core areas, supporting the provision of high quality service, advancing public policy, which we're really excited to get to chat with you all about today, promoting research on the efficacy of the interventions, and then sharing best practices among our member agencies. We do this through 3 core programs. First, our accelerator, where we work to partner with existing nonprofit organizations and teach them the medically tailored meal model. And that really refines, replicates, and scales this proven intervention model. Then, through our membership program, we support a diverse community of existing practitioners to deliver responsive MTM and MTG services. And our newest, our accreditation program. So we launched the first ever field-wide standard about 1.5 years ago, which defines this intervention that we've now delivered for over 40 years. We've been really excited to see that reference now in 4 state-based state Medicaid policy guidance. And this really ensures fidelity to the high quality medically tailored meal intervention. So, healthcare integration, which is the particularly exciting piece we get to chat about today. So, despite all this wonderful research and despite all these decades of experience honing quality service provision, there is still no dedicated federal funding for medically tailored meals. So, not OAA, not WIC, not SNAP, not emergency food funding. The only exception is the Ryan White Care Act, and that sometimes covers nutrition for people with HIV, though it does not often cover everyone who comes to our agencies living with HIV who needs services. Most of our agencies and nonprofit providers raise a majority of their funds from their communities. So these amazing research outcomes, though, have led to many states and individual Medicaid and Medicare plans to leverage certain flexibilities to cover MTMs for high risk, high cost patients. And this is where we've really led the field to advocate for leveraging these state-based authorities. And on the screen here, you can see some of the existing authorities that are used to fund and deliver medically tailored meals. Most advancements in food as medicine integration with healthcare have occurred in Medicaid primarily, and there is some advancement in Medicare as well. Importantly, MTMs are generally a not reimbursable benefit for enrollees in state Medicaid programs, but more and more states are electing to cover food as medicine through a waiver or through a special program. And I'll pop a resource here that we have. We published a state Medicaid guide for Food as Medicine in partnership with the Center for Health Law and Policy Innovation at Harvard. So what you all are getting to talk about today and what is so exciting for Missourians is the recently introduced bills directing your state Medicaid department to pursue a Section 1115 demonstration waiver. And the Section 1115 demonstration waiver authorizes Missouri to temporarily modify Medicaid programs through experimental, pilot, or demonstration projects to promote Medicaid's objective. And the state can use the Section 1115 waiver to expand eligibility, test new service delivery, and incorporate services not traditionally covered by Medicaid, like Food as Medicine nutrition services. And today, more than 49 million people receive Medicaid coverage from a state that provides access to nutrition services through an 1115 demonstration. So Missouri is not the first state to decide they may want to pursue a Section 1115. And there's been some really exciting state-based innovation that has occurred in other states leveraging this authority. Importantly, while much success has been seen in these pilots, they fall short of expanding the widespread coverage needed to ensure equitable access completely across the country to these critical services. So as a colleague in the field of mine often says, Food as Medicine, if you think of Medicaid or Medicare as a house, Food as Medicine is currently getting in through the window. And a lot of what we do at the Food as Medicine Coalition and as advocates in the Food as Medicine field is try and open up that front door. So of course, if we can get Missourians through the window, that's what we want to do, right? But we'll do that in tandem with some really exciting national efforts to expand services that are working on turning that doorknob and opening that front door. Because as you can see, there's a high degree of complexity in navigating these acronyms for CBOs and healthcare, let alone our clients trying to access services. So really what we focus on at FIMIC is changing healthcare policy to fund, deliver, and explicitly evaluate the MTM intervention and other Food as Medicine services in Medicare and Medicaid. And we see these state-based authorities as a vital part of expanding access to life-saving Food as Medicine services in tandem with these really exciting national efforts as well. Really looking forward to hearing more from state-based champions today. And if time allows, happy to take a couple questions if that's okay with the Empower Missouri team.
I think our plan is to, at the end, let everybody ask questions, if that's okay. Wow, I learned a lot. I hope everyone else learned a lot too. That was fantastic. And I really like the, right now we're getting in through the window and we really want to open that door. I appreciate you, Kate. Thank you so much for sharing your expertise and with everybody. So the next slide is just a little bit of information on what kind of impact this kind of program could have on Missouri specifically, and why we hope to get you guys fired up to support the proposed legislation. Like Kate was saying, chronic diseases, including heart disease and diabetes, remain among the leading causes of death in Missouri. Heart disease specifically is number one, according to the CDC. 35 to 37% of Missouri adults, that's a third, are classified at risk. And it's associated with nutrition quality. Our fellow Food as Medicine advocate, Dr. Kristen Crimes, with the Family Medical Center in Springfield, recently told me, quote, "In her clinical practice, food and nutrition are central to prevention, treatment, and recovery. This legislation allows Missouri to bring proven comprehensive nutrition interventions into the healthcare delivery system, improving chronic disease management while ensuring programs deliver meaningful outcomes." End quote. Next slide, please. And then I would be remiss if I did not mention the costs that are associated with insufficient access to healthy food. Limited access to healthy food exacerbates chronic disease by undermining disease management and increasing reliance on really expensive medical care, such as emergency rooms and inpatient care. Feeding America's Healthcare Costs of Food Insecurity Analysis estimates that it is associated with approximately $1 billion per year, that's just in Missouri, in avoidable healthcare costs. And I want to point out that that $1 billion, that's only like direct like medical care. It doesn't even factor in missed work due to illness or caring for an ill dependent. The Missouri Fresh RX Nourishing Healthy Starts program is a food as medicine pilot ran by Operation Food Search in the St. Louis area. It addresses food insecurity and other social determinants of health for women enrolled in Medicaid during pregnancy and through 60 days after giving birth. It provides a weekly meal kit for the entire family, nutrition education and counseling, recipes and videos, as well as kitchen supplies. So pilots such as this collect the information necessary to prove that food as medicine programs improve health outcomes and save money. This pilot in particular reduces the likelihood of babies being born underweight who require more medical intervention than babies born at a healthy weight. They ran this pilot for a 20-month period with 75 babies delivered, and they were able to show that food security increased by 44 percentage points. Participants' low birth weight rate was 5.3 points lower than Medicaid in the St. Louis city. And preventing low birth weight deliveries for those 75 babies saved $189,000 in healthcare costs. That's just during the pilot. So they projected a Medicaid cost savings of $5.3 million in St. Louis City alone. So this pilot was targeted for pregnant women, but I just wanted you guys to imagine if it was expanded to all of Missouri or to all Medicaid recipients with conditions that could be improved through nutrition. That's exactly what some of our legislators have imagined. So this session, which we're almost a month into, it's going very fast. We have 3 legislators, Senator Hudson, Senator Mosley, and Representative Jones, who have filed legislation to create the Food is Medicine Act. And these bills would direct the Department of Social Services to apply for a demonstration waiver to implement a Food is Medicine program through MoHealthNet. And the bill language includes services such as case management, nutrition counseling, meals or pantry stocking, nutrition prescriptions, and grocery provisions, all to be provided for under Medicaid. It also includes the prioritization and inclusion of community-based organizations and local growers to support the purchase of locally grown food in nutrition prescriptions when feasible. This would be an excellent and incredible opportunity for small farmers and small businesses in Missouri. I'm not going to get a whole lot into the weeds of that, but I will share I'm going through a really big report just on that, how local food in Food is Medicine programs stimulates the economy. And the number is for every dollar spent, you're getting between 32 cents and $90 in addition of local economic benefits. So the Food is Medicine bill sponsors are able to see clearly the benefits of a statewide Food is Medicine program. But there are many more people that still need convincing that this act, for this act to be turned into a law. Like pretty much everybody on the committee, so that the bills have been referred to, and everybody in the House and Senate who will have to vote on it, and ultimately Governor Kehoe who would have to sign it. It is a very long process that requires a sustained effort and participation from people just like you all. And I'm going to turn it over to Christine because now is the time.
Thanks, Amanda. And yes, that is right. Now is the time. That's our call to action. So one of these bills is already moving, and it's an important time for us as advocates to let our legislators know about this important issue and for us to encourage them to move the bill forward. So in this legislative session alone, there's over 2,000 bills that have been filed, and even the most knowledgeable legislator in that building cannot know about each and every one of them. Even if they spent 24 hours a day, 7 days a week reading bills, they would never be able to understand and read all of them when they needed to. So that's why it's important as advocates for us to reach out and use our voice to let legislators know what issues are important to us and what actions they can take and we want them to take to move these bills forward. So that leads us to the call to action that we're asking you all to take part in today. So Representative Holly Jones's bill, which is House Bill 2355, it was assigned to the House Health and Mental Health Committee, and it is most likely, things can't always change, but it's most likely going to have a hearing in that committee next week. So next Thursday, I believe. And so it's a really important time for each of us as advocates to reach out to those committee members about this issue and about this bill, educate them about what food is medicine is, and how when they do hear this bill in their committee, that they will think about the importance of it and move it forward to the next step of the process. So we are asking each of you now to take just a couple minutes to click on the link that I think someone's going to put into the chat. Or if you want to use your phone, you can click on this QR code and we'll take you directly to our call to action. And what it is pretty much a email template that will automatically be emailed to all of the members of that health and mental health committee. Right now, there is some draft language of the email talking about the bill and telling the legislators what we'd like them to do with it. But you are more than happy to edit it and to make it personalized or add anything else you would like to add to it before it gets sent to it. But at a minimum, you're more than welcome just to send it and get it sent to those committee members, asking them to pass it on through their committee when it gets to that point. Yes, I'm going to answer Trisha's question as we go into doing this call to action. Yes. So in addition to just doing this quick online form, once the bill does get noticed up for the actual hearing and the date and time, there is an opportunity for folks to submit testimony online where you could type up specific testimony that you want to be submitted and put on the record. But you are also more than welcome to come with us to Jefferson City and give in-person testimony, which is by far and away the most effective way to talk to the legislators in those committees at the time. So we will give you more details on that when we get to the point of it being announced with the specific date and time of the committee hearing. Thank you, Rika. The call to action has been placed into the chat, so feel free to just click on that link, and we're going to take just a couple minutes to take the action. And then once you are done and you're finished with the call to action, we'll wait here a couple minutes. Just let us know by putting your favorite fruit in the chat. You can either do it by the emoji or you can just put the name of the fruit that's your favorite. And then we will move on and talk about a few other things that you all can do to help us move food as medicine forward.
Ashlyn, I'll pull it up and drop it real quick, the bill language.
And as folks are filling this out, I will put a plug. If you put your favorite fruit in, think about sharing this call to action with a friend, a relative, a mom, an aunt. People are getting more and more active during these times. And so think expansively about who in your network might also be interested about reaching out and saying they support Food as Medicine program in Missouri, and take your time to share it with them or on social media or otherwise as well.
I did just drop the bill language in case anybody wanted it. And I compulsively want to talk about each fruit that anybody drops in the chat. I'm like, ooh. So while we're waiting, I do want to tell a story that ruined me. I mean, I still eat peaches, but a long time ago, I was driving to Texas and there was a roadside stand, kind of like a snow cone stand. And I was like, oh, it was hot. It was like July. So we pull over and they were selling peaches on a snow cone, like those paper cones that snow cones come on. And I'm like, this is weird. And like 50 napkins. So we get ours and get back in the car and start eating it. And there was so much juice. We actually had to pull the car over and everybody had to like stand outside the car to eat these peaches. It was one of the best things I've ever eaten in my entire life. And now I just, I'm ruined from any peach that is not like that.
All right, we're going to give 1 more minute. All right. Thank you all so much for taking time to make your voices heard and take part in our call to action today. As I said, it has not been noticed up for a hearing, but we are hopeful that it will likely hit a hearing not this week, but next week. But a great way to follow along with the process of this bill, along as all of our other food security policy priorities, is through our food security bill tracker. If you click on that, it will show all of the bills that our Food Security Coalition is following, including all of the food as medicine bills, and it will tell you where it is in the process. So once the hearing gets noticed up, it will show the date, the time, the location of the hearing. It tells you when the bill gets passed through the committees, moves on to the House, all of that. So this is a great way to just kind of stay informed of what's happening with the bills, about when where it moves through. And you can see on the next slide, there are quite a few other ways that you can be an advocate, besides just taking action through our call to action today. Another great way to be an advocate is to submit letters to the editor in your local newspaper. It's a great way to help educate the community and the public about certain bills and about certain issues, specifically ones that you're passionate about. We put together a guide about writing letters to editor that will kind of take you through the whole process about writing a letter to the editor, how to do it, the best way to draft it, the word count, how to submit it, and everything, all the sorts that you need. So this is a great way to kind of look into another way you can do, be an advocate right in your own home. You don't even have to go anywhere. You can do this and submit it online to all of your local newspapers. And it's a great way just to get the word out there to the public about some of these issues and get it up more widespread than just what's happening in the Capitol building. And then next, another way you can do it is to join us in person. Our in-person day of action at the Capitol in Jefferson City will be on February 17th. It's a really great way to see up close and personal the legislative process and take part in it yourself. So Empower Missouri will gather all of our advocates from all 3 of our coalition areas together that day for a rally and a day of learning and a day of action. It's a great way to kind of tip your toe into the in-person advocacy world because you'll be supported by us as staff of the Food Security Coalition, and we'll have meetings set up in person with legislators throughout the day, and we'll join you for those meetings to kind of help you learn the process and share the talking points and kind of be a support and have your back during this whole kind of day of learning. It's free, and it includes a lunch and a t-shirt. So please RSVP and join us for that day in Jefferson City. We'd love for all of you to be there with us. Empower Missouri is also a sponsor of another advocacy day that takes place just a week later on the 24th. This one will be focusing also on food as medicine, like our day, but it's going to be broader than that. It's also going to include a lot of other food and farming issues as well, and includes a lot of other statewide and local organizations, all focused on farming and food. So we would love for you to be a part of that day as well. I think Amanda has a link that you can register for that day. way if you want to do some more in-person advocacy around farm and food and access to food and healthy food. And then finally, it's very important for us to each reach out to our own state legislators. So each of us have a state representative and a state senator that is in the state capitol representing us. And they're the people, they want to hear from you. They want to hear from their constituents. They're the ones, they care most about what you have to say and what issues you care about. So it's really, really important to know who your state legislators are and reach out to them often about the issues and the bills that you are passionate about. If you do not know who your legislators are, you can go to the Missouri State Senate website. I just dropped that link in the chat. There is a legislator lookup on that page where you type in your mailing address, and it will tell you who all of your representatives and senators and policymakers are, all the way from Washington, D.C. Down to the state level. Once you figure out who your state representative and state senator are, reaching out to them via email or calling their offices and sharing your thoughts on those food as medicine bills is a great advocacy tool as well. I think the next slide is just a pictorial slide about our day of action. That picture is from our last year's day of action. So we hope that you can join us this upcoming year and join us for that photo as well. And I think now we do have a little bit of time that we're happy to answer any other questions that anyone has about food as medicine or about the bills or about any other advocacy process questions that you have.
Kate is still with us too. So you've got the expert on if you want expert answers.
This is Felicia. So on Senator Mosley's bill and the other bills, it's 3 total. So Jones is the only bill that's moving right now. Is that what's happening?
They have been referred to committee, but last time whenever I was in the Capitol, I was asking, and the legislative assistant to the Speaker of the House can see things that we can't see, and said that it was being scheduled for a hearing. And that's why we kind of said, like, we think, because it's still not published yet.
Or is that for 2355?
Yes, that was for 2355. And that's the only one that we've heard that there is a hearing being scheduled for so far.
Okay.
Ashlyn, did you have a question?
Yeah, I learned by example, and so I'm curious, have you all seen this policy implemented in other states where it's working well? That would be helpful to kind of call others' attention to how it's working elsewhere.
Oklahoma pulled it off. And that's actually where this legislation came from. Senator Hudson's legislative assistant is Daniel Seitz, and he worked on it in Oklahoma. And so when he came to Missouri, he convinced Hudson that it should be a priority. And then Hudson convinced Representative Jones it should be a priority. And I think Mosley had been on it before. Not necessarily filed legislation before, but had worked on it or has at least talked to some people about it. And so she was really on board with it too. And I just looked it up, and hers has not been referred to a committee yet, Mosley's. So just the Hudson and Joneses have been referred to committee.
Kate, did you have more to add on that?
I did, yes. So there's quite a few states with really successful implementation of 1115 waivers. Chilpy, the Harvard Law folks, are actually working on a tracker for what states are leveraging what Medicaid authorities to cover food as medicine services now. So that'll be a bit more public and widespread at that point. I will say Massachusetts's waiver is really looked at as the gold standard. They have some really incredible work that's been done by state advocates. They have a state food as medicine coalition as well. And they also have a food as medicine state plan. And that plan is really another great entry point if you are a newer food as medicine advocate, considering what 1115 implementation could mean for your organization or for your community. So I would also point definitely towards Massachusetts as well. But there's quite a few. I think we're still under 10, but I think it's at 7 or 8 at this point, leveraging 1115s.
I did have a quick question on the federal landscape around nutrition currently. And so your organization, Kate, has been doing this work for decades, long before MAHA and other interests have kind of taken center stage at the federal level. Do you find that that's influencing state decision makers who are like, oh, our party's leaders really think that food dyes are more important than like feeding our bodies? Or is that just still looked at kind of as separately? Like, should we be ready to address that if we're walking in a very red state down the halls with legislators?
Yeah, Trisha, that's such an excellent question. I would say I wish I had a really easy, simple answer for that, and I just don't, right? It looks a little bit different in every conversation we have. But I will say food as medicine, since our inception, has been bipartisan. And in our national efforts to get bills passed around food as medicine, we have had consistent, very solid bipartisan sponsorship and support. And I think obviously part of that is like the fiscal conservative argument of you can save healthcare dollars and improve health outcomes. It's truly a win for everyone involved. I would say we have seen a more concerted effort to engage in food as medicine work since the new administration. We did have, the last administration also was pretty invested in food as medicine as well. So I think we've seen continued support, but then also kind of this increase in conversation around how can nutrition support health. And I think that's how we choose to orient those conversations is how can nutrition support health? And how can we also show that we have done decades of work to set both states and the federal landscape up to be successful in engaging in food as medicine. There's a proven, demonstrated multiple interventions that work. And we also have bill language, in particular in Medicare. There's a Medicare bill that we're very focused on at FIMIC right now that like you can move that bill and you can have a food as medicine win tomorrow.
Yeah, thank you for speaking on that. Sounds like it's just bridging of like, yeah, food and nutrition is really important. Let's talk about it. And then getting back to maybe what's been proven for decades. Thank you for that.
Absolutely.
Donna.
Yeah, I think that's a really interesting point. And I noticed, Kate, you mostly were focusing on the medically tailored meals or also medically tailored groceries, which I think from a federal level, given some of the indications from the Center for Medicaid and Medicare that seems like they're trying to make sort of food as medicine fairly narrowly defined by those 2 or even 1 option of medically tailored meals. And I mean, I guess I would advocate that we take a little bit more broader approach to also include things like produce prescription and even lower down on that food as medicine pyramid, because medically tailored meals and medically tailored groceries are incredibly important for the people that really need it, because they have certain very, very specific health criteria or health issues. But let's push the public health preventive. If we can prevent people by giving them access to healthier food from getting cancer, diabetes, heart disease, all those things, let's push that envelope further. And I think our work with KC Fresh RX is really showing that absolutely it is making a huge difference for people who are lower, who are on Medicaid, for instance. So I would go for that. Let's go for the gold.
Yeah, Donna, really appreciate that point. At FIMIC, we focus on MTG and MTM just because those were our interventions of focus at our inception. We do have a colleague in the field, the National Produce Prescription Collaborative, that we work in really close partnership with, and they're really the leaders nationally in produce prescriptions. So I think a lot of what we do here at FIMIC is talk about how important MTM and MTG is, and how important every level of that pyramid that I showed in the beginning is to population and community health. That we are really treatment oriented and, some tertiary prevention, but that without a strong SNAP program, a strong WIC program, more folks will end up needing MTM and MTG. So we, in our advocacy priorities, we talk about how important Medicaid is. We talk about how important SNAP and WIC are as complementary to the treatment-oriented interventions like MTM and MTG. So absolutely in agreement, Donna. We all have to work together to really hammer home how important these interventions are and life-saving.
Yeah. And
I'm going to reiterate, I just want to reiterate that the bill actually calls out, like the language includes case management, nutrition counseling, meals and pantry stocking, nutrition prescriptions, and grocery provisions. And the sentence above that says to include, but not limited to. So it literally the Missouri bill says nutrition prescriptions.
Yeah, and in Missouri, there are amazing programs already that are testing these things out. Double Up Food Bucks is in that pyramid, and it is across the state of Missouri. And then I know, St. Louis, Springfield, in Kansas City, lots of different things going on. So there's just some really great work. It's just how do we get it so that it's paid for? And it keeps going.
Yeah, exactly. And if you guys have anybody who's on this call access to data or information, please share that with us. I'm going to drop my email in the chat just in case you don't have it. But I'm trying to compile data to use in presentations like this, and also to include, oh, thank you, include in language when we're going to the Capitol, when we're putting together testimony or press releases, all those kinds of things. Missouri specific data is even better than national data. Thanks, Rika. Does anybody have any more questions? We've got about 5 minutes left.
I got a question.
Sure. Hi.
Hi. So my question is, I heard mentioning of nurse practitioners, and I just wanted to get more information of how are they so helpful. I know we went through it pretty quick, but how the nurse practitioners so helpful, and with them, do you think that it'll be better if they got a full practice authority? Would that be better for this program, or any bearings on it?
I can Empower Missouri team. I can speak to that quickly, and please feel free to add any additional context. So part of our interventions integration with healthcare is truly a no wrong door entry model. So somebody could come to us and say, I have HIV, I'm managing a severe health condition, and these meals would make a difference for me. And we will support them in coming onto service. They'll be evaluated by an RDN, but also our organizations go to their treatment team and say, we want to confirm that you think this is the appropriate intervention, that this person may not need produce prescription or a medically tailored grocery, but that they, can't stand and for more than 10 minutes at a time and prepare a meal, or they can't leave their home and purchase groceries. A really important part of that is a nurse practitioner. Sometimes that person is a social worker. So that would be how our organizations are currently engaging nurse practitioners in that process, is having them look at a patient's health history, be the primary provider for a patient even, and say, this is the appropriate intervention for them, and really collaborate with our provider organizations in that way. So absolutely, nurse practitioners are deeply engaged in the process of service provision currently.
Thanks, Kay. Awesome job. Any more questions? We have 3 minutes left. I don't know about you guys, but sometimes I will end something or end a conversation and then I'll be driving or cooking and I'm like, oh, I wish I would have asked that. So if that happens to you, you are welcome to email me, call me if you want. However you would like to ask your question, you are welcome to. Dr. Hampton, were you coming off mute on purpose? Oh, you're still on mute if you're talking.
I was just saying thank you. I put it in the chat.
Oh, thank you. We thank every one of you for joining us, and hopefully we'll get to see you tomorrow and Wednesday for the other 2 rounds. Empower Missouri team, do we have anything else?
Nope. Thanks, everyone, and have a great rest of your day.